Blue or green-colored urine is quite rare, but it can provide important clues about your body. The blue or green color in urine usually appears due to pigments from certain medications, such as antibiotics for urinary tract infections or anesthesia drugs. In addition, some foods and drinks containing artificial coloring can also cause this color change. Sometimes, certain bacterial infections that produce colored pigments can also turn urine blue or green. If you see blue or green urine, but feel healthy and have no other symptoms, it is usually just a temporary effect from the foods or medications you have consumed. However, if the color persists along with symptoms like pain, fever, or foul-smelling urine, you should see a doctor immediately. Brown urine. Brown-colored urine can be a sign that your body is experiencing certain conditions that need attention. Brown urine usually appears due to several causes. One of the most common causes is severe dehydration. When the body lacks fluids, the urine becomes very concentrated and changes color from bright yellow to dark brown. This condition indicates that the body needs more water so the kidneys can work properly to remove toxins. Besides dehydration, consuming certain foods like asparagus or medications such as metronidazole and some types of laxatives can also cause urine to turn brown. Brown urine can also indicate serious health problems. For example, liver function disorders like hepatitis or cirrhosis cause bile pigments to enter the urine, making it dark in color. Another condition to watch out for is severe muscle damage, rhabdomyolysis, which releases a substance called myoglobin into the blood and eventually into the urine, turning it dark brown. Additionally, severe urinary tract infections or the presence of blood in the urine can also cause it to appear brown. If brown urine is accompanied by symptoms such as pain when urinating, fever, nausea, vomiting, or yellowing of the skin and eyes, these are signs that you should see a doctor immediately. Clear. Have you ever noticed your urine is clear, almost like plain water? Well, clear urine can actually mean two things. First, it might mean you're very well hydrated. This means you've been drinking a lot of water, maybe even more than your body needs. A well-hydrated body is good because it helps your kidneys flush out toxins more efficiently. So, if you've just exercised, the weather is hot, or you've been drinking a lot, clear urine is completely normal. But if your urine is frequently clear and you urinate in large amounts, it could be a sign of something worth paying attention to. For example, you might be drinking too much water, causing your body to flush out excess fluids constantly. This can disrupt the balance of electrolytes in your body. The second possibility is that clear urine can appear in people with diabetes, both diabetes mellitus and diabetes insipidus. In these conditions, the body expels more fluids than normal, making the urine very diluted. If you also feel constantly thirsty, pee often, especially at night, and feel easily tired, it's a good idea to see a doctor. In conclusion, clear urine can be a sign of good health. But if it happens too often, especially with other symptoms, you should stay alert. Light yellow. If your urine is light yellow, it's actually a very good sign for your body's health. This light yellow color comes from a natural pigment called urochrome, which is a result of the breakdown of hemoglobin in the blood. When you drink enough water, this pigment mixes with the water in your body, producing a bright and fresh yellow color. Light yellow urine indicates that your body is well hydrated, meaning you are not lacking fluids and your kidneys are working properly to remove toxins from your body. Usually, this light yellow color appears after you've had enough water, and your body is in a balanced condition. It also often appears in the morning if you drank enough water the night before. However, if your urine changes to dark yellow or orange, it could be a sign that you are starting to become dehydrated and need to increase your fluid intake. Similarly, if your urine is cloudy or foamy, it could indicate a health problem, such as an infection or kidney issues that need to be checked. So, maintaining light yellow urine is a simple way to ensure your body stays healthy and hydrated. Dark yellow urine. Has your urine ever been dark yellow or orange? This color usually indicates that your body is starting to lack fluids or is dehydrated. Dark yellow urine occurs because the fluids in your body decrease, causing the natural pigment, urochrome, to become more concentrated. This means your kidneys are conserving water by producing less but more concentrated urine. Mild dehydration can happen if you haven't drunk enough water, especially during hot weather, after intense exercise, or when you're sick and losing a lot of fluids. If left untreated, dehydration can make you feel weak, dizzy, and can potentially harm vital organs like your kidneys. Besides dehydration, dark yellow urine can also appear if you consume certain foods like carrots or vitamin B complex supplements. So, when you see dark yellow urine, it's your body's signal to increase your intake of water immediately. Try to drink about 1.5 to 2 liters of water daily, and more if you're active or in hot weather. Orange urine, pink urine. Pink-colored urine can be concerning, but one of the most common causes is food, such as dragon fruit, beets, or berries that contain strong, natural pigments. This color can appear without any blood present and usually goes away after 1 or 2 trips to the bathroom. However, be careful. Pink urine can also be a sign of blood in the urine, a condition known as hematuria. It can be caused by a urinary tract infection, kidney stones, or other issues in the urinary system. If pink urine is accompanied by pain, fever, or cloudy and foul-smelling urine, it's best to see a doctor right away. Blue-green urine.